15,000 Minnesota nurses ready for fight as contracts end. No deal has been reached to extend the contracts of 15,000 Minnesota nurses at 15 hospitals. Most nurses' contracts end on May 31 at 12 hospitals in the Minneapolis-St. Paul metro area, while the remaining nurses' contracts expire on June 30 at 3 Duluth hospitals. The contracts for Minnesota's nurses come at a time when the state's healthcare system is in a state of crisis. As a result of unsatisfactory staffing levels, hospitals have been forced to deal with overburdening and hazardous conditions. Pandemic and corporate greed have exacerbated the already tense situation. Over the last year, thousands of healthcare employees have taken to the streets in protest. 301 days of strike action by nurses at St. Vincent Hospital in Massachusetts. In Newark, New Jersey, hospital employees are now on strike, while last week, mental health workers at Minneapolis-Allina and M Health Fairview hospitals launched a one-day walkout. Healthcare strikes have taken place in California, particularly at Stanford and Cedars Sinai hospitals in Los Angeles. Strikes by 10,000 New Zealand healthcare employees and 15,000 Indian healthcare workers were reported on a global scale. These striking healthcare professionals have shown that they will not back down from a struggle for themselves and their patients. In all of these battles, the unions, which subject themselves to the political parties defending capitalism's profit system, have damaged them. As a result of the epidemic and understaffing, nurses in Minnesota and around the country are experiencing high levels of stress, burnout, despair, and even suicidal thoughts. When a patient's mental health concerns escalate into violence, nurses are often the ones who are left holding the bag for the hospital. The Trump and Biden administration's reluctance to undertake a scientifically grounded program of eradication to remove COVID-19, along with incorrect and inconsistent information, has resulted in considerable uncertainty, particularly among those obliged to seek treatment in packed hospital emergency rooms. Nurses and other healthcare employees have taken the worst toll of this bullying. Far-right groups have fueled misunderstanding with conspiracy theories. In January, a fascist podcaster used the death of a COVID-19 patient at Allina's Mercy Hospital to incite a lynch mob against medical professionals.